My name is Miguel Garza, and I'll be presenting a clinical vignette titled Disease and Disparity, a rare neurosyphilis case in a middle-aged woman in the Rio Grande Valley with my collaborators Ed Alvarado, Andrew Galazach, and Dr. Daniel Hernandez. We come from the University of Texas Rio Grande Valley School of Medicine, partnered with Knapp Medical Center Department of Internal Medicine. Introduction. Treponema pallidum is a causative agent of syphilis with diverse symptoms. After primary infection, it can progress to neurosyphilis, affecting the central nervous system. Symptoms of neurosyphilis may appear 1 to 2 years post-infection and may initially be asymptomatic. Early neurosyphilis symptoms may resemble meningitis, with symptoms including headaches, visual issues, and nausea. Advanced neurosyphilis can cause peripheral neuropathy, gait changes, and mental health issues. If untreated, it can lead to permanent damage such as blindness or paralysis. Syphilis rates in Texas have progressively risen since 2021, especially in South Texas, where the incidence of syphilis grew by 32% in the Rio Grande Valley counties of Cameron, Hidalgo, Starr, and Willacy. The rise in cases is widening the syphilis incidence gap between South Texas and the rest of Texas, with syphilis rates among Hispanics almost 2 times higher than among non-Hispanics in the region. This case represents a 52-year-old Hispanic woman from an under-resourced area, diagnosed with neurosyphilis after the acute onset of neurologic and psychiatric symptoms. Socioeconomic issues and limited healthcare access in such areas can lead to untreated chronic illnesses, including syphilis. It is the growing incidence of syphilis that calls for urgent early detection and treatment to avoid long-term complications. Case description. In this case, we present a 52-year-old Hispanic woman with no pertinent past medical history who presented with acute onset left upper extremity weakness, numbness radiating from her neck to her third finger, and 2 weeks of psychiatric symptoms. She also reported the appearance of progressively worsening pruritic macular rash 3 days prior found on her palms and upper body. CT scan was negative for hemorrhage, and an MRI of the head and neck showed no evidence of ischemia. Concerns were raised for compression neuropathy, therefore an MRI was ordered and showed evidence for spondylosis of C4-C5, which did not account for systemic symptoms and acuteness of her presentation. An RPR was reactive, prompting further evaluation for a full syphilis workup after ID recommendations. An LP was performed, significant for treponema pallidum antibodies TPPA, consistent with the diagnosis of neurosyphilis. A psychiatric consultation resulted in diagnosis of anxiety secondary to syphilis, with recommendations to focus on treatment efforts of the patient's underlying medical condition. After administration of penicillin, episodes of nausea and vomiting developed due to gyrosarcine reaction, with subsequent complete resolution of symptoms. The patient was safely discharged and provided with 3 additional IM penicillin doses outpatient to be administered at home city's health department. As you can see in figure 1, this is a representation of the pruritic macular rash present on the upper extremities, palm, and dorsum of the hands. Discussion. We present this case to outline a common scenario in an underserved area community such as the Rio Grande Valley, where disease progression is affected by limited healthcare access and minimal health literacy. Combined with the socioeconomic factors that precipitate neglect of chronic illnesses, these circumstances facilitate the propagation of many preventable and treatable conditions, such as syphilis, and enable its progression to secondary syphilis and neurosyphilis, potentially causing irreversible consequences in a person's health. There is an increase in the local incidence of syphilis, and the permanence of socioeconomic disadvantages indicate a need for early identification and intervention to prevent long-term disease complications in this vulnerable population. In conclusion, this patient's acute onset systemic and neurologic symptoms, pruritic rash, and psychiatric issues represent classic manifestations of neurosyphilis, a rare yet relevant complication of treponema pallidum that can present months or years after initial presentation. In this presentation, we underscore the local relevance of syphilis, as the Rio Grande Valley's limited healthcare access and low health literacy contribute to a higher incidence and disease burden, especially in the Hispanics of the region. This case emphasizes the need for early identification and intervention, with the purpose of preventing long-term complications and enhancing patient outcomes in these vulnerable communities. Thank you for listening.